Hi, everyone. We'll get started in just a moment. Got a few more people on the waiting list I'm letting in. Thank you so much for joining us today. I know you have a lot going on. It's quite a busy week in the world across our state, and you who are treating patients, you have your hands full. So really appreciate your time in joining us today. I think I have everyone off the waiting list so we can get started. My name is Libby Sagara. I run the eConsult work group, which is actually a national group of payers, providers, and patient advocates promoting eConsult for improving access to specialty care. And I am so happy to be able to work with you across the Central Valley to support eConsult and getting providers up and running, making sure that we have the education and tools that we need to help providers to support their workflow in eConsult. We have a good number of new members on our work group today, or our roundtable today. And you may notice also that we've changed the name of our coalition. We are now the Central Valley eConsult Coalition. For those of you who started with us a few months ago, we started out as Fresno, but we realized we have so much more, or so many more providers than just Fresno providers involved in our group. So we now wanted to be able to reflect that. So we are the Central Valley eConsult Coalition. And as people are jumping on our call today, I'll just quickly review our agenda. We want to give a moment for those who are new to our coalition to introduce themselves. So those of you who are on chat, if you wouldn't mind, just give me a quick little blurb in the chat if you have that ability. That would be wonderful. And those who I see, I will actually call you out and ask you to introduce yourself briefly if you don't mind. I've asked everyone to place themselves on mute because we have about 40 people on our call today, so thank you for doing that. We are so pleased to have a wonderful representative of telehealth and advocate and researcher, Dr. Denise Payan of UC Merced, speaking about eConsult and equity today. So we're pleased to have one of our own Californians, a Central Valley native, to speak about what's happening with eConsult and telehealth across the state in improving access and equity. We want to talk about specialists and primary care provider communications, outreach, and education, and get your input as to how we can better support the spread of eConsult across the Central Valley. So those of you who just joined, my name is Libby Sagara. I'm with the eConsult work group, and please feel free to use the chat to pipe in any questions or comments that you have as we go here. I'm looking at the chat, and I'm just going to sort of scroll through to do a couple of brief introductions here. I'm so glad that we have a great representation from our eConsult platform and technology experts on the phone today. We have a new guest, a new provider, Arista MD. So we have a good number of representatives from Arista. Thank you so much for joining us. We have also Rubicon MD and ConfirmEd on the call today, and a few different provider organizations. Steve, you introduced yourself, Steve Cade. Thank you so much for joining us. Valley Children's, I believe. If I got that wrong, please do correct me. And just scrolling through, we have Ashley Willingham with ChildNet Medical Associates, Valley Children's. I believe that's Steve's organization too. Anyone else who is new to our group, if you wouldn't mind sharing a chat with us to call out your organization, that would be really helpful so we can make sure that you're represented. We have a good number of our FQs represented today, and since we have so many, I'll just call them out. I'm so glad that Omni was able to join us, United Health Centers, Family Healthcare Network, I know you're on, and we do have representation from our payer leadership from Anthem, Calviva, and HealthNet on the phone, along with California Health and Wellness. And if you would like to introduce yourself, if I've missed you, if you're a new organization that I have missed, please feel free to unmute yourself and you can speak out. I'm not going to be too strict on the mute, aside from blocking the outside noise. So anyone else that I missed? Okay, thank you so much for joining us today, all of you new attendees. We meet on a monthly basis. For those of you who are new to our roundtable, we want to be able to offer a forum, although we're a big group, offer a forum for discussion, Q&A on what you may need for support for eConsult across your organizations. We want to make sure that you understand the level of support that the managed care plans across the Central Valley are providing to this organization. They are truly committed to making this work for providers. So I welcome you to unmute yourself, comment if you wish, use the chat to comment as we go through our material today. And I just want to give a quick overview of what we have learned about your organizations as we have rolled out across the Central Valley. We have a good number of FQs, 6 of you who are across multiple counties. Your span is great. And I know also your hands are full right now. You are dealing with a lot in terms of patient care. So thanks for taking your time to join us. We're going to be seeing more and more clinics get up and running over the next couple of months, we know. We want to congratulate those of you who have gotten up and running on eConsult, or those that started out in other counties and now rolling out to Fresno and additional counties. So welcome new participants, welcome FQs to joining, or who are joining us, and other providers who are independent practice providers and hospitals who are joining us too. I'm going to take a moment, see if our plan sponsors would like to say any words. Joel, I know you're on. Are there any words you'd like to say to get us kicked off today? I might be putting you on the spot, Joel.
No, sorry, I ended up having it. Yeah, no. Yeah, no, I'm good. I think you covered it. And I'm sorry I'm joining a couple minutes late in here, but yeah, no, I'm really excited to see the progress here, and I don't think I have much else to add.
Great. Yeah, not joining late at all. So thank you so much. And Jeffrey Nakansa, I know you're on too. Do you have any words that you wanted to say to kick us off?
No, Libby, I think, just welcome to see so many familiar faces, and very excited about how we're progressing. So excited to be here today.
Thank you, Jeffrey, so much. Dee Iverson, I'm not sure if you're on quite yet. Dee, are you there? Okay, well, Dee from HealthNet, I'm sure will be piping in with us later today too. So thanks so much for your support of this program. Quickly, for those of you who are new to our group, we want you to note that there are a couple of different resources out there for information, what's happened over the past couple of months in terms of getting your counties and clinics up and running. So we send out a monthly update, or we will be sending out a monthly update, a newsletter to you all. So you should have gotten this in your email inbox. If you don't have it, I'm happy to forward you. You can always send me a chat and I'll make sure you get this information. So we'll be sending out a monthly blast to you all. And in addition, we have our Central Valley eConsult Coalition website. So these are all available to you to be able to get the most recent information. We did send out a Central Valley press release. So if you want to click that link that you see on your screen or in your inbox, you can read our recent press release thanking the plans, thanking Anthem, Calviva, and HealthNet for their financial support in offering grant funding to support the FQs in rolling this program out. So thanks everybody for your engagement over the past couple months. I want to take a moment to congratulate Camarena. Thank you so much, Camarena, for sending off that first Fresno eConsult. And we know that a few of your clinics have been active in other counties. Family Healthcare Network, I know you're on the phone today too, and I know you're very active in sending eConsults, and we look forward to seeing additional FQs get up and running over the next couple months. And I just noticed Dr. Joel Ramirez just popped on as I congratulated Camarena for getting started. So thank you, Dr. Ramirez. And with that, I want to get to the key topic of our conversation today. We don't want to ignore the fact that we are a state, well, we're a country in crisis. We not only have the crisis of COVID, but we have that layered on top of what was already a horrible challenge in terms of access to care for patients across our state. So I know you're probably experts in this all, you live this every day, but we wanted to share a recent report. This came out of Robert Wood Johnson in 2020. The fact that the Central Valley is dealing with issues greater than any others across the state. It's a region, you are a region that are facing access challenges that are very difficult to be able to address. So as we roll out eConsult, we want to be thinking about that we want to keep that top of mind, that access to care and quality of care are those priorities that we want to be able to not lose track of as we implement eConsult across your clinics. So as we were thinking about that, we have a wonderful contact who's on the phone with us today, Dr. Denise Payan, who has done some great research on how telehealth can really address challenges in equity and access. And so Dr. Payan is going to share her work today, and I want to be able to entertain any Q&A, so please do use your chat if you have some comments, questions for Dr. Payan. And let's think together about how we may be able to focus our program on tackling these challenges of access and equity. So Dr. Payan, I'm going to ask you to unmute yourself. If you need help with that, I'm happy to do it. But I'm going to hand off to you, Dr. Payan of UC Merced. So glad to have your organization supporting this effort. Dr. Payan, would you mind introducing yourself? And I'll click your slides for you to move forward.
Sure, thank you. Libby, is this okay?
Yes, you're on. Great.
Can you hear me?
Yes.
Okay. Good morning, everyone. So my name is Denise Payan. I'm from UC Merced. I'm an assistant professor of public health there. And I run the Community Health and Innovative Policy Lab, or CHIP Lab. I wear a couple of hats. I'm a health policy researcher by training. My area of expertise is nutrition policy, but I've also been involved in health services research projects. Up to date, mostly in South Los Angeles, where I was for about 7 years. And then now more recently, a couple of, in the past year, a telehealth study that's currently in progress in the Bay Area with the hopes of actually conducting more health services research here in the Central Valley. And I am here in Merced. My family is here. We love being here, but there's also some challenges that we've realized and the differences between the Bay Area, Los Angeles, other parts of California. It's a really special and unique part of the state. And so I'm actually involved in a couple of COVID studies that I'll mention as they pertain to technology access, and for the purpose of today, thinking about equity and the patient perspective, so patient-centered care and how that actually intersects really well with equity. I'm also the deputy director of this UC-wide effort, the California Initiative for Health Equity and Action, or CalIHEA. So I'll mention, which is mostly at Berkeley, but now it's a UC Merced, UC Berkeley initiative. So in a couple of slides, I'll talk a little bit about that. Oh, next slide. So just to start off, everyone here, health equity has become ubiquitous and almost, to the point of a buzzword in the last couple of years. So I kind of just want to start off, this is kind of just the definition of health equity and thinking broadly about it. So health equity is achieved when every person has the opportunity to attain his or her full potential in health, and no one is, quote, disadvantaged from achieving this potential because of social position or other socially determined circumstances. And so everyone here on the call can think about the social circumstances that do come into patient outcomes and health outcomes. And Libby, you can click through. I have some animations. You can click through the animations so that can come up if you don't mind. And so to thinking about evidence-based policy, so research evidence-based policy that can integrate community and patient perspectives. And one of my overarching goals is to think about health policy more broadly, not only as healthcare policy, but also public health policy. Because public health policy and social determinants of health do contribute, I think, speaking to the choir here, to health outcomes. And what, especially some of our healthcare organizations who disproportionately see some of these outcomes and are impacted in care. And so some of the work I've been involved with prior to coming to the Central Valley was with FQHCs in Los Angeles, 3 FQHCs of varying sizes. And one of my earliest studies focused on clinical community linkages to adopt evidence-based interventions in FQHCs, and how it was a process evaluation of how to do that to address and improve care for patients that disproportionately face a lot of challenges with their health because of lack of transportation, lack of medical access, and a host of other challenges. And so one of the goals I hope to have is, how do we move from a buzzword, health equity, to actual practical implications for policy? And today I'll really focus on for healthcare outcomes for patients. And so one of my efforts is through CalIHEA. And so CalIHEA is this UC-wide effort that has a couple of priority areas. These are the 4 priority areas, some of which I think may be really interesting and relevant to people on this call. So one being building a workforce for health equity. And so that's really a key part. Just broadly thinking about e-consults, which focus on provider-provider interactions, right? Primary care and specialty care. But building a workforce for health equity really supports those efforts. What is the racial, ethnic diversity, other types of diversity that's represented in the healthcare workforce? We really think about the healthcare workforce, but also health administration, allied health professionals, and a lot of other professions. And so That's one of the aspects. Another priority area is improving health access for all immigrants, which more so focuses on coverage, advancing universal health insurance coverage here in California, and then addressing the social determinants of health through cross-sector collaborations. So we actually have host of different activities. Now we have these policy briefings that are webinars on a monthly basis. So if you're interested, I put the link here. You're welcome to sign up just to get to the newsletter, and we disseminate also relevant research on health equity from all of the UCs in our newsletter. So if you're interested, you can click on the link and sign up for our newsletter to learn more about efforts or activities related to CalIHEA. And so now I'll focus more on moving into eConsult. And so I actually just learned about eConsult in the last 12 months, just about. The work that I'm doing is a telemedicine study, which I'll talk about in a little bit. But when I first learned about eConsult, this is kind of the image that came to mind. You know, that old game that, you know, is not COVID-19 appropriate, but this telephone game where you have one person start off with a word and it just goes down the chain. And by the end, you know, peas has turned into fleas, as you see here. And so what it really highlights is communication and miscommunication and misunderstanding. And the thing that's not here, you know, this very simplistic illustration, would be the, you know, this actually has health outcome implications, the effect on the patient and their perspective. But I am a health communication researcher as well. I've done a couple of studies, and so what I'm going to present today is thinking about health communication and even how this delivery of health services research, vConsult, how we can think about the patient and what the patient ultimately, their role, their preferences, and how you can actually utilize your healthcare organizations and other assets in your healthcare organizations. I applaud Camarina Health. I also know they have community health workers, as several of your organizations do. And so some of what I'll talk about is how to leverage your existing assets to support eConsults to be successful, but also to promote equitable outcomes for your patients. And so part of it is, you know, this modified telephone game, how can we make it successful? So P's, the word can be, you know, what goes in can come out correctly. And so we think about other challenges, language, hearing loss, disabilities, comfort, trust, understanding. These are all aspects in health communication that do play into, you know, what you get out of the telephone game or e-consultations. Next slide. And so this actually is a schematic that just kind of, you know, represents, people here have probably seen, that just represents what eConsult is. And then what I want to talk about briefly is just how do we think about the patient and where does the patient fit in? And so I added this piece. So at the end of the day, the goal is for this to improve patient outcomes and population level outcomes as well for your healthcare organization. And so important things to consider that do play in, that are part of the broader, that situate the broader context for eConsults and any type of use of telehealth for the delivery of health services, is a provider-patient relationship and trust. So thinking about, you know, does that exist? Is there trust or mistrust? The communication mode, so phone, virtual, in person. Now we have several modes that are now being utilized and will continue to be utilized beyond the pandemic. So language access issues for health information, health literacy of your patient population, patient-centered strategies that are already being utilized, the patient's preferences. So even in e-consultation, thinking about the patient's preferences to see a physician or the specialist, how does that factor into your workflow model? And then shared decision-making, which just thinking about that, you know, what information, what is the patient preference, where does that fit in terms of e-consultation? And I think, you know, I watched a little bit of I applaud everyone's efforts. I watched a little bit of the prior meeting. So I'm really glad that this coalition is expanded, started off with Fresno and then expanded to the Central Valley. And I think also things that are not, I didn't put this here, but also rurality, technology access, broadband, these are all really important pieces to think about as well to make e-consultation successful for your health organization. And so the next slide, this is not, so one of my main points is to promote equity. So tying it back to the actual step, to promote equity in e-consultation, how do you center and support this provider-patient relationship, the patient and communication, even in e-consultation? And so that'll be one of the takeaways. And by the end of this, in a couple minutes, I'll just go through a couple of examples of how to do that. And so this slide, actually, it's not my slide. It's from a colleague of mine, Irene Yen, who's at UCSF, and she's now at UC Merced as well. But it really highlights how culture and language contribute to patient experiences and patient satisfaction. So it's a study that was published a couple of years ago in the Bay Area. And I just pulled out a couple of quotes from patients with different dominant languages than English. And so it just highlights the importance of language access and how that plays into the patient's experience in a healthcare setting, which many people here are already aware of. So the first quote just says, "I don't know because I don't understand English." And then whatever I tell the interpreter, he is relaying the information in English and then relaying what the doctor says back to me. There is a gap. And so what I want you to think about is there are patients who use interpreters, right? But e-consultation is actually adding another step. So imagine a patient who is already utilizing interpretation services because their language is not English and their primary care physician's language is not the same as that patient. But now e-consultation may be creating another step where the primary care physician is going to the specialist and it's coming back through the primary care physician and then goes out through a language interpreter. And so that's actually, another step that we have to think about that may lead or cause further gaps and is very important. Language access needs are really highlighted as being important consideration and being addressed. And then another quote from this piece, seeing a doctor who does not speak Spanish makes the visit to the doctors more difficult because we don't have any clear communication. Maybe the symptoms will be not interpreted correctly. So the patient's perspective of what the information that's being presented, the diagnosis, that being another aspect of communication. And so I just bring this up. This is not a study on e-consultation, but it highlights the importance of the existing equity barriers in healthcare and how those can actually become worse if e-consultation and the steps don't kind of address these issues as well or think about them. And here in the Central Valley, we do have really diverse racial, ethnic populations, low socioeconomic, high levels of poverty, and additional challenges where there's a lot of potential for success for e-consultation, but these issues and the broader social and cultural context of the patients do matter and are really important to them. So in the next slide, this just focuses on the current study on telemedicine. So we are not asking about e-consultation, but the study that I'm conducting in collaboration with Hector Rodriguez at UC Berkeley is focused on FQHCs and implementation of telemedicine. For some clinics, the first time. For others, broad expansion of telemedicine. But it's this, telemedicine is going to continue. We don't know at what rate. It seems to have kind of hit a high last year between May through June as a substitute for in-person, but then in FQHCs that we've interacted with and then other groups, it seems to have kind of dropped off, but it seems to have still, and then gone up again, but it will be sustained as a tool to deliver health services, not only in a pandemic, but in other circumstances. And so, be interesting to hear what all of your different experiences with telehealth in your own organizations. And for some, it's phone. So this new definition of telemedicine, some clinics had 95% use, predominantly phone, not really video visits. And so even thinking about why that happened, was it patient issue, was it provider kind of difference in acceptability, reimbursement was certainly, and confusion about reimbursement was part of that. But kind of the broader context is telehealth will continue and e-consult is part of this. And part of it is there are actually a lot of benefits that I won't go into, but even the idea that there are long wait times, that is a really strong reason to use e-consultation or other types of telehealth services to help the patient experience and address those types of issues. And then click on the next, Libby, if you don't mind, the optimal. So there's this optimal strategy, right? For, in this case, telemedicine, the person has appropriate Wi-Fi access or broadband. They're able to see their physician, the physician's able to see the patient. But in reality, as most of you, some of you have seen this with your own patients, in the next piece, the reality for individuals is a little bit different. not being able to, see your patients when you meet them. It's been a phone call, which is a great resource, but at the same time suboptimal to a video visit to actually see your patient, for the patient to see the physician and build that trust, or improve health communication and the delivery information. And then what has actually happened, which is a good or a bad thing, I won't make any statements, but the inclusion of a support system. So some of the physicians are seeing the family members. Individuals are receiving support to get on. Digital literacy is a huge issue for patients, which some of your health or care organizations have been dealing with, or your frontline administrators have been dealing with in the past almost year. And so some of the study that we're conducting is a mixed method study and has two components. And one of the components is actually interviews with physicians and FQHCs, and then also patients and FQHCs, mostly Spanish-speaking patients, because we are interested in language access issues and other equity considerations during the pandemic that came up. And we're actually not focused on COVID-19, but we're focused on chronic care and the delivery of chronic care via telehealth. In our case, we're really focused on telemedicine, and that study is underway. And so some of the things we're looking at are language support, privacy concerns, the broadband issue being really, really critical, preference for phone versus video, and kind of the different, we want to compare and see the physician perspective and actually healthcare leaders and other operational staff as well on the supply side, and then the patient's perspectives as well. And some of the pieces about satisfaction are related to, reduced transportation burden, increased access to providers, which are related to eConsult as well. So on the next slide,
Dr. Pan, can I interrupt really quickly?
Yes.
I want to encourage any questions that you'd like to share with Dr. Payan, please share via chat. And I want to bring up one observation, Dr. Payan, which is relevant to your comment on being able to connect back with the patient. Often the specialist may not speak the same language as the patient, and being able to convey that advice following any consult back to the patient. Dr. Delphine Tuot, who was one of our advisors, brought up a great point. She said, thanks for bringing this up, the language disconnect. Interestingly, when we conducted focus groups with English and limited English proficient patients in San Francisco a few years ago, patient comfort with the eConsult was all about trust in the primary care provider, particularly for limited English proficient patients, just as you said. So please do share these comments. Delphine, if you'd like to elaborate, please do. And I welcome your questions.
Thank you, Libby, for bringing that up. Go ahead. Is that?
Yes, thank you.
Sorry, this is Delphine. No, I just wanted to say that we saw something similar here in San Francisco, that it was even for limited English proficiency patients, or particularly for LEP patients, I think comfort with eConsult was really about trust with PCPs. And as much as we could have language concordant PCPs, or at least use of interpreter use among the patients and the PCPs, patients felt comfortable with eConsult, thinking that they were getting like the proper messaging from their PCP to the specialist. So it was actually considered a positive for many of our LEP patients.
Thanks, Delphine.
Thank you for sharing that. And I also think that highlights the use of, another qualitative research tool, focus groups. So interviews, focus groups, these are really great tools that for, quality improvement or internal projects, you can quickly assess your patient needs and perspectives. And this finding related to the importance of the PCP for the interaction is validated by existing health services research, particularly for limited English proficiency patients. So thank you for bringing that up. And it's a good model. You're a good resource for others, focus group scripts for how to do that as well. And so this is my last slide that I'll end with, that focuses on solutions and also strategies to support patient-centered care using eConsultation. And so one of the ways to strengthen shared decision-making, your processes and patient communication, it's also, enhancing patient experiences would be leveraging your assets. A lot of you do have community health worker programs or promotores de salud. So leveraging those assets to be integrated in this model, there's different modalities. So how are they communicating or asking or sharing information about eConsult as this transitions? Integrating patients and making sure they're also getting information about this, this transition is really important and what is actually happening. And in many cases, it's community health workers or promotores who have relationships with your patients and have that trust. So you can really leverage that. And also thinking about how these community health workers are tied to the providers who are using eConsult and are engaging with patients. Another aspect, so the next piece here would be thinking about promoting high quality interpretation and translation, which many of you are doing, but really the importance of language access needs, and producing literacy appropriate and culturally sensitive communication materials about eConsultation. And the eConsult Coalition and Libby, they have wonderful resources about appropriate patient materials and also how to assess where your patients are with this. And so using these tools and engaging your patients as you roll out is really important as well. And the next piece, and actually I did conduct a study on community health workers just focused on breast cancer prevention, and we found that one of the mediators is self-efficacy. So patient self-efficacy was actually really related to their increased health education. And that may be part of the way that community health workers actually can increase or improve patient level outcomes. So just mention that piece. And then on the next, so mandating, incentivizing communication training for staff and providers, documenting provider engagement and decisions, which I think I've already heard a little bit the group has previously done when I was scanning through the prior meetings. And then increased hiring of PCPs and specialists and recruiting and retaining a diverse workforce. So this is part of one of what I mentioned earlier with CalIHE and some of the work that I'm interested in. And I'm also engaged in the UC Merced, UCSF medical school initiative. So, longer term plans to support mentoring, training, and really the Central Valley pipeline for medical students and medical providers, but also other aspects of the healthcare workforce, supporting those initiatives as well, even if they don't result or yield in the next year. This is part of what needs to happen for the Central Valley to address some of the shortages as well. And then the last piece at the top is documenting access, cost, and quality outcomes, which many of you already do because of payer requirements, but also just thinking about other aspects. So patient preferences, their patients' access, who is using eConsult as you roll it out, who is, on our telemedicine study, we're looking at the new no-shows in telemedicine. So thinking about, who isn't benefiting or who is declining e-consultation or wanting to meet the specialist. So those are things that you can continue to work for quality improvement, just access improvement initiatives. And so with that, I will stop. Thank you, Olivia. I hope I didn't go over my time, and I'm open and available to questions or comments.
Thank you, Dr. Payan. I'm going to stay on this slide since I think this captures so much of the work that we are doing across the Central Valley, and so many of these themes are what we are really focusing on doing as part of eConsult. I welcome questions coming in via chat. You're also welcome to unmute yourself if you'd like to talk directly to Dr. Payan. We have a good number of people on. I think it's so important to come back to the issue that both you and Dr. Tuo brought up, that we, as a work group, one of our focus areas is not just connecting the primary care provider to the specialist, but then what happens once that communication has closed? Once there is a decision made and that advice is given from the specialist to the primary care provider has the relationship with the patient, as you all know. So many FQs are on the phone today. And how does that primary care organization convey that advice back to the patient in a language appropriate means? If there is a phone call, if there is some sort of connection back to that patient, to let them know what's happening next, what's the next step. So thank you for these ideas on how to do that. Any questions for Dr. Payan? You're welcome to unmute yourself too. I do have a quick question. So one thing we think about often is that although in this world people may not have great phone access, that there may be difficult. It may be difficult for a patient to have a phone visit or a live video televisit. What are you finding, or have you found anything at this point in your research, Dr. Payan, in terms of text? So let's say you did an e-consult and conveying an outcome or a decision made by a specialist and a primary care provider via text to patients. Have you seen anything in that modality?
Well, in terms of the health services research, well, we're in our own study, it's not really available to a lot of patients, is what we're finding. So it depends on the healthcare organization and the platform, actually, because texting in some cases, you're not able to document it very easily, the replies or the bidirectional information. And so it can be a challenge, and some healthcare organizations opt to not use it at all. In terms of patient preferences, a couple of larger studies that have found that a lot of lower income populations would prefer it. So Medi-Cal, there's a study in Los Angeles that found that a high percentage would like to have that option with their providers and utilize that. Most phones are, it's low, the data limits are kind of very low. It's not the same as a video visit. And a lot of people do it now, the older age. So seniors are kind of the one limitation. We are finding that in our study. They've had the biggest issue with telemedicine and even with phone visits and using those platforms to contact their patients. So texting might be an additional issue. But mobile messaging is something. I have conducted a study, not in healthcare, but it was in faith-based organizations with mobile messaging with Latino and African American patients who were uninsured or underinsured in Los Angeles. And a high percentage of them loved having this mobile messaging health promotion kind of texting, but they wanted to be able to reply and engage with something. So that's something that healthcare organizations need to think about. There's a high preference if it's available, but how do you actually capture that information or respond or have the appropriate person respond? Because patients can share inappropriate information, or someone else might have that phone as well, right? Their child or someone else in the household might have access to it. But there's this unmet demand for texting for health information.
Yes, I'm so glad to have your thoughts on that. And Dr. Payan, we look forward to hearing what happens with your research and your findings. It'll be great to see what happens, pre, during, and post-pandemic, where we go with telehealth in terms of improving access. So, Dr. Payan, I think your research is so interesting and relevant, especially with this time. I think I skipped one of my slides. I wanted to bring up a piece of research that you will all receive in your inboxes. It was actually, it just came out in December, and it was from Massachusetts, actually, but it was titled E-Consult Access and Equity. So it just piggybacked on what you have been focusing on, Dr. Payan, but really specifically to e-consult during COVID-19. So we will follow up and share that piece of research with you all, and continue to hopefully hear your thoughts, Dr. Payan, on our work. Thank you so much for your time today.
Libby, thank you. Thank you to the e-consult work group, the California Healthcare Foundation, CaliHIA, and then Citrus is funding our study. So I just wanted to mention that. And I just really applaud everyone's efforts in this learning community, because this is, I think, a model for healthcare organizations to break down the barriers of competition and to learn from one another, which is what we need for early adoption and for success. I just want to applaud everyone's efforts and thank everyone for allowing me to be here today. So I'll be able to join for the rest of today's meeting, but thank you so much for this.
Thank you, Dr. Payan. So one thing that we want to do, and it can be challenging with a group of 40 people on the phone, is to get your input. We, as part of this group, want to be able to connect primary care providers and specialists and the organizations, and we're very pleased to have Adventists on the call today, along with ChildNet Valley Children's, to talk about how we can work together to build that communication on a local level. So Central Valley Primary Care and Specialist Communications. As you all know, you have access to a great network of remote specialists to be able to conduct e-consults, and we really hope to build that network locally too. So what we're doing over the next couple months is building out those strategies and tools to be able to engage local specialists. So what we'd like to do is to have your help. Those of you who are FQ members, we are so pleased to have Central Valley Health Network on the phone too. Thank you, Mary. All of those who have those relationships with your specialty organizations, obviously you FQHCs have your referral partners. we want to be able to outreach to them and to engage them in the program in any way that's appropriate. So our first step is to provide a lunch and learn. So we're going to have a webinar similar to this one, basics of eConsult and what the role of the specialist is. So Dr. Delphine Tuot and Dr. Darren Anderson, who are on our phone today, who have over 5 years, if not 10 years of experience in eConsult, will share their best practices in specialty response to eConsults and sort of the what's in it for me for the specialists. So we are in the process of trying to set up CME for this course, but those of you who happen to represent the specialty side of the equation, please do mark your calendar for February 10th. That's the day that we plan to have our lunch and learn, and we'll be sending out communications. We hope that you can send them to your colleagues who are specialists. So some of the key messages, and I welcome those of you who are specialists on the phone today, piggyback and unmute yourself and pipe in here, but we do have the opportunity for specialists to really tackle this challenge in terms of regional access to care, population health issues that we brought up over the past few slides here, and increase access to care because it is so scarce, and this is a more efficient way to be able to use the few specialists that we do have in each specialty. These eConsults are reimbursable encounters for specialists. As you probably all know, there's a CPT code for specialist response, and the average is less than 10 minutes of a specialist time to be able to respond to any consult. And you've all seen so much data. I know we throw research at you nonstop, but there is so much of it out there in terms of positive experiences, satisfaction, and then efficiency. So eConsults resulting in a reduction of unnecessary face-to-face visits, those that are for routine and non-urgent needs of the patient. So this frees up those appointments that are available for the patients that do need to see a specialist face-to-face. So here's just a quick snapshot, and those of you who represent hospital systems and specialists who are on the phone today, please pipe up or please share with me if you want to join in getting the word out here. We want to be able to partner with your local specialist referral partners. So we have a list of health systems here that we did a quick snapshot of what we think is available out there in terms of high need specialties, but we need to hear from you, FQs. Who do you send your referrals to? Who can we reach out and be able to engage in this work group to improve collaboration across Central Valley? I'm going to take a pause here. Anything to add, FQs? If there's anything, if we have any IPA comments here, anyone who wants to pipe in, please be able to unmute yourself.
This is Steve Kay here from ChildNet and also representing Valley Children. So yeah, we're thrilled to be involved in this. I know we're kind of this is our first meeting, so we appreciate the invitation and yeah, just agree with all those strategies and the needs that are up above, and we share those same needs. So we're definitely aligned in trying to achieve the same objective, and we'll be happy to do whatever we can to support this. So we look forward to being a resource.
Thank you, Steve. Thank you so much. I'm just going to take a minute that I realized I did not introduce Charla Duncan from Adventist earlier. I just noticed that she's on. Thank you so much for joining us, Charla. If you have anything to add, please do. And other health systems that have joined us, thank you so much for taking the time to join. So with that, I'm so sorry, I got my slides out of order. This is the research that I had mentioned earlier, the study that's come out around safe and equitable coordination of virtual outpatient specialty care, connecting primary care providers and specialists during COVID to really focus on that fragmented communication and improve health of individuals and populations during COVID. So here's a link to that study if you'd like to take a look to that, at that. And just a quick look here. You've all seen this slide before if you've joined our past roundtables. We have a few key messages that we want to be able to share with our primary care organizations who are doing eConsults. We're hoping to see this become just an easy step to incorporate into primary care providers' workflow with the tools and support that we can provide. So we want to be able to do what we can to support that process and make things more efficient for primary care. So we hope to look at eConsult as a first step for routine and non-urgent, non-procedural referrals. We want to be able to make this available to all primary care providers and staff across your FQs and your private practices. And we hope that this is a simple process to be able to tackle if it's a realistic goal of doing, say, 1 e-consult per primary care provider or referring provider per month. We feel like that's a fairly simple baseline goal, but we welcome your input here. So we are going to be tracking this and sharing our successes as a program. So we want to be able to share once your clinics have launched. And so if you can share your launch dates, we're working with your e-consult technology platforms to be able to do that. So thank you, Camarena, for doing that, for sharing your launch with us. Family Healthcare, I know, is getting up and running very soon here in Fresno too. And you're already up and running in other counties. Those of you who are launching, thank you for sharing your experiences. So I'll pause here just for a moment, see if there are any FQ updates you'd like to provide. Dr. Ramirez, do you have anything you'd like to share with us? I'm going to put you on the spot briefly.
No, I'm sorry, I'm driving, don't have my camera on, but I thought it was a great presentation. Dr. Payan, a lot of really helpful and relevant information as you highlighted, Libby. So no, I think I don't have anything particularly to add at this point. Thank you.
Thanks, Dr. Ramirez. Matt Miller, I know you're on the phone too. Do you have any updates you'd like to share from Family Healthcare Network or comments? Matt, you might be on mute. All right, I hate to put people on the spot. We'd love to hear from you and make this as interactive as possible. I know it's hard with a large group. Love to open it up to any other FQ comments or questions.
Hey, Libby, this is Matt from Family Healthcare Network. Can you hear me now?
Yes, hi, Matt.
Hey, yeah, nothing too much to update. As you alluded to, we are in the process of rolling out in Fresno. We had a call just last week with some folks with ComproMed and everything else. So we're on track to get that up and going and hope to see the same success that we've had in Tulare County up in Fresno County.
Thank you so much, Matt. United Health Centers, Omni, anything you'd like to add? Or Sean from Valley Health Team, I think you're on too. Okay, we'll pick on you all next week. Thank you so much for sharing.
Yeah, no, I was going to say, this is Joel Gray over at Anthem. No, I appreciate that. I was just thinking with Libby, it'd be great to have the different health centers have some time on this roundtable and provide, any updates, just like we kind of did. But also love to hear, any challenges, any successes. One of the things I'm also eager to start tackling is I've heard in the past from some of the leaders of several of these health centers that you have large backlogs of specialty referrals, and that e-consults may be a way to start bringing that backlog down and tackling it. So yeah, I think it'd be great to give all of you some time to speak and talk about this collectively, and again, really start just pushing the envelope here. I mean, sure, if we could get to 1 per PC per month, that'd be great, but if there's an opportunity to tackle large backlogs, maybe even stratify those backlogs by ethnicities, I don't know if we can do that, but thinking about the focus on disparities right now, are there some options here to really make a big impact and difference, as we start the new year on e-consult and the volume. So appreciate any of the health centers on board with this, just being willing to speak up during this and give your updates and talk about these things and use the time for that.
Hey, Libby, this is Sean from Valley Health Team. Sorry, I was on the whole double mute issue.
Oh yeah, no problem, Sean. Go ahead.
Yeah. So we're still on track to go live at the end of this month. We've been working closely with our vendor ComproMed to get going, and it's looking like we'll be on target. We had an initial presentation done, completed by our associate medical director to all of our staff, and we had a lot of favorable feedback from our providers, so that was exciting. We have our actual training. We're going to have a training from Dr. Anderson on the 28th of this month to all of our staff again, but with a focus to our providers. So looking forward to that, as well as we're working on our referral training that we're trying to get scheduled here for our teams and get that all fleshed out. So still on target to have that up and running by the end of this month, and we're excited to see the progress.
Thank you so much, Sean. And we'll look to our February meeting to really hear from you all, since I know everyone is in the throes of getting launched, along with caring for your patients in a really tough time. So thanks for taking the time out today to join us. And we'll look forward to hearing you in 1 month, where we'll have, I think the majority of our clinics will be launched. So thank you so much. I'm gonna skip on to just a couple of more administrative announcements. So as you all know, we need help. We need help to stand up e-consult and telehealth in clinics and health systems. So we wanted to keep you aware, and I'm sure you've heard of this through your grant teams, but please do keep track of what's happening with FCC. There will be telehealth funds available. Just keep track of what's happening on the FCC website for funding specific to telehealth during the pandemic. And we will share any updates that we have on next month's call. And in addition, if you need information on our program, if you want to know what's happening around the next webinar, topics that we'll be sharing, you can visit our website that is listed here. Here's the URL for you all. Please do bookmark that. And if you do have any examples to share with us, if you want to share some success stories, if there are any great patient engagement anecdotes you want to be able to share with us, we'd love to be able to feature your clinics and practices and use of eConsult. We'll post our videos in case you're not able to join one of our monthly calls. These will be posted to our website too. I have a couple more people joining, which is fine to hear the last few announcements here. So please do save these dates that we have here, our February 10th Lunch and Learn, to be able to engage our local specialists, and also love to hear from primary care providers who would like to join in and share some of their best practices and be able to talk to specialists in order to engage those groups. We will plan our next roundtable mid-month. I'm throwing out a tentative date, but I will check with you all so we can make sure to have a quorum. I'm impressed with the number of folks we have on the call this month, considering we have inauguration and all these big events happening this week. So we'll make sure to not plan around any major political events. We wanted to announce that although we meet as our Central Valley Coalition group, in addition, we have a monthly eConsult work group, which is sharing national best practices and California-specific policy updates. That's happening tomorrow. So if you would like to delegate someone to be able to join that monthly meeting, you can hear what's happening across the country. So that's our January eConsult work group. And our next February eConsult date is there so that you can mark your calendars for that too. I'll pause and see if we have any announcements from the group, anything you'd like to share. If there's anything from Jeffrey or Joel or Dee Dee, anything you'd like to share before we wrap up?
I'll just make a comment that I think it's really important, I guess, as we kind of progress here, and looking forward to the February meeting, to be able to continue hearing from the clinics and the primary care providers who are actually delivering the e-consults. I know, from a perspective here administratively, when you are looking back, you might not be able to quite readily see, how the direct patient care or the provider, or how the care is being delivered. But I think as we start rolling it out and hearing from the providers or the PCPs and seeing the e-consults be utilized, it'll be good to know if it's going as what we planned, if it's actually increasing the access, are we seeing the data, are we seeing positives, so that we can continue that push. I know from our perspective, we're very engaged in trying to remove any kind of barriers or things that are out there that might be a roadblock to this, because ultimately our goal is to try and make sure that we're getting access and patients are being able to get where they need to go. So just any feedback or anything that you're able to share in these upcoming meetings would be helpful.
Thank you, Jeffrey from CVeC. So with that, I'll make sure to add to our next agenda a clinic report out. So all of you provider organizations can share your progress, any comments that you have around the program. And Joel, anything that you'd like to share as we wrap up?
No, I think, Jeffrey, you summed up my thoughts really well, as and you heard me say something similar too. So I think we'll definitely enjoy hearing more from the clinics, rolling up our sleeves, and just really trying to work on execution at this point, go forward. I did mention to Libby offline that, hearing some of the talk earlier about language challenges and language barriers, there might be an opportunity throughout all this. It's not e-consults, but it is related to at least language barriers that may have a factor in here. Several health centers on this call are actually participating in our kiosk project and have access to on-demand video and audio remote interpretation in their exam rooms. And I love the fact that this is a coalition, and if there's an opportunity, if we want to talk a little bit about that and see about, Jeff, maybe CalViva plan and opening up more access, which further reduces language barriers in Central Valley and improves health equity. Would love to have that conversation.
Thanks so much, Joel. So I have one piece of homework for the providers who are on the call today. We would love to have the contacts, your referral contacts, to be able to engage them as part of this specialist outreach. So the specialists and organizations to whom you refer, we'd love to invite them to our monthly coalition calls, but also to invite them to this lunch and learn, and just make sure that they receive specific communications with regard to the program and the successes that we've seen so far. So you can always use the chat, send this to me right now if that's easy for you. If not, I will email you directly, so you FQs can expect to get more communications from me. So providers, thank you so much for sharing your specialist contacts. And with that, we wish you a healthy winter, and we'll see you next month. Thank you so much.